Advances in medical care have had a tremendous impact on how well and how long we live. Globally, life expectancy has more than doubled over the last century. At the same time, expectations have changed. With unprecedented access to information about nutrition, health, and healthcare, people are more aware than ever of where systems fall short and where there are opportunities for improvement. This awareness of the shortcomings in the modern medical system naturally leads people to investigate other disciplines and philosophies in medicine and to look for alternatives. With that in mind, it is worthwhile to draw a distinction between evidence-based medical disciplines and the alternatives. Modern medical care in the United States is built around the use of clinical trials, scientific research, and the systematic application of evidence to guide diagnosis and treatment decisions. This approach is broadly referred to as evidence-based medicine. Evidence-based medicine involves three essential components. First, the best available scientific evidence derived from well-designed controlled trials, systematic reviews, and meta-analyses, with careful attention to minimizing bias. Second, the clinical expertise of well-trained physicians to interpret and apply the evidence in the context of each individual patient. Third, the awareness that each patient is unique. The strongest medical evidence typically comes from systematic reviews and meta-analyses of multiple well-constructed randomized controlled trials. Randomized controlled trials can provide high-quality evidence on their own and involve randomly assigning participants into groups to determine the effectiveness of an intervention. Two common pitfalls in medical reasoning are the over-reliance on anecdotal experience and on physiologic plausibility. These are distinct problems, one rooted in bias and observation, the other in theory, but both can lead to unreliable conclusions when not supported by clinical evidence. Anecdotal observations and individual clinical experiences are not considered reliable evidence for determining the effectiveness of a diagnosis or treatment. Physiologic plausibility alone is not sufficient to guide diagnosis or treatment. Even well-reasoned theories can be misleading, particularly when they are not supported by clinical evidence.